If Nonfiction Labs were to invent a way to reliably engineer proteins to be responsive to magnetic fields, such that you could take this magnetically responsive module and attach it to anything, not just fluorescent proteins, but antibodies and other types of molecules, what would that actually mean for medicine? And how might it change the way we treat diseases?
Yes, so that's a very good question. I think the dream of being able to control without taking other cues in space the activity of a drug, it's in a sense would be fantastic. So the example that you gave with antibodies, the idea of having cancer drugs, which today bring with it lots of side effects, and being able to minimize those by activating the drug just where you want it is it's something that we dream that we can make possible. And also from the the fact that many of the drugs today are failing because of side effects and toxicity, and being able to rescue a lot of those um, would I mean drug development is expensive, so it would be nice to be able to rescue and make drugs that are currently not working because the patient cannot tolerate the side effects, things that work.
So it's not about just creating new types of drugs. It's about, can we take drugs that failed clinically because of toxicity, make them magnetically responsive, and then somehow make the drug only active like near a tumor, for example, but not toxic elsewhere.
That is exactly the dream of Nonfiction Labs. It's what we're working towards,
Yeah.
right?
Yeah, yeah. And I think the cancer drugs are the thing that occurs to us first. It's the goal that's the quickest to explain. If I'm in an elevator with somebody, I lead with cancer drugs because everyone can imagine I'd want more medicine on the tumor, I want less side effects everywhere else. The other applications I think that might take a little longer to explain if you get an organ transplant. Would you like the immune system suppressed in your whole body? Or would you like the immune system suppressed just near the organ? If you take a drug that has therapeutic activity through the whole body, but damages this organ in particular, like if there's a drug that damages your heart, if there's a drug that damages your liver, wouldn't it be cool if we could take the edge off the drug's potency just in the vulnerable organ and leave it potent everywhere else in the body? Not that we're working on painkillers or small molecules, but wouldn't it be cool if Advil only worked in your head? I'd take more Advil if it didn't damage the rest of me.